and with permission, I'd like to make a statement about the work to tackle coronavirus. This virus continues to spread. Yesterday, there were 7,108 new cases. However, there are also early signs that the actions that we've collectively taken over the past month are starting to have a positive impact. Today's REACT study from Imperial College suggests that whilst the R number remains above 1, there are early signs that it may be falling. We must not let up, but people everywhere can take some small hope that our efforts together may be beginning to work. I put it no stronger than that. Cases are still rising. However, as the Chief Medical Officer set out yesterday, this second peak is highly localized. And in some parts of the country, the virus is spreading fast. Our strategy is to suppress the virus, protecting the economy, education, and the NHS until a vaccine can make us safe. Earlier this week, Mr. Speaker, we brought in further measures in the northeast. However, in parts of Teesside and the northwest of England, cases continue to rise fast. In Liverpool, the number of cases are 268 per 100,000 population. So together we need to act. Working with council leaders and the mayors, I'm today extending these measures that have been in place in the northeast since the start of this week to the Liverpool City region, Warrington, Hartlepool, and Middlesbrough. We will provide £7 million of funding to local authorities in these areas to support them with their vital work. The rules across the Liverpool City region, Warrington, Hartlepool, and Middlesbrough will be as follows. We recommend against all social mixing between people in different households. We will bring in regulations, as we have in the northeast, to prevent in law social mixing between people in different households in all settings except outdoor public spaces like parks and outdoor hospitality. We also recommend that people should not attend professional or amateur sporting events as spectators in the areas that are affected. We recommend that people only visit care homes in exceptional circumstances, and there will be guidance against all but essential travel. Essential travel, of course, includes going to work or school. Mr. Speaker, I understand how much of an imposition this is. I want rules like this to stay in place for as short a time as possible. I'm sure we all do. The study published today shows us hope that together we can crack this. And the more people follow the rules and reduce their social contact, the quicker we can get Liverpool and the North East back on their feet. We're also aligning the measures in Bolton with the rest of Greater Manchester, and I'd like to pay tribute to David Greenall, the leader of Bolton Council, for his constructive support, and the Bolton MPs for all they've done in support of Bolton. There are no changes to measures in West Yorkshire, West Midlands, Leicester, Lancashire, or the rest of Greater Manchester. It is critical that the whole country acts together now to control the spread of this virus. So please, for your loved ones, for your community, and for your country, follow the rules and do your bit to keep this virus under control. Mr. Speaker, by its nature, this virus spreads through social contact, and so it's had a terrible impact on the hospitality sector, who in good times exist to encourage that very social contact that we all enjoy. So we've had to take difficult but necessary decisions to suppress the virus. The only alternative to suppressing the virus is to let it rip, and I will not do that. So whilst I know that many of the individual rules are challenging, they are necessary, and there are those early signs that they're working. In the measures we've introduced, including the 10 p.m. restriction, we're seeking to strike a balance, allowing people to continue to socialise safely where that's possible, while reducing the social contact that the virus thrives upon. Elsewhere in the world, they've introduced an evening restriction and then seen their case numbers fall. And we know that later at night, people are less likely to follow social distancing. Now, of course, we keep all our measures under review and we'll closely monitor the impact of this policy, as with all the others, while continuing our unprecedented support for hospitality businesses, like cutting VAT, support for the pay of staff, offering rates relief for businesses, and giving billions of pounds of tax deferrals and loans. Mr. Speaker, our hospitality industry provides so much colour and life in this country, and we will do whatever we can to support them while acting fast to keep this virus under control. I know that these measures are hard and that they are yet another sacrifice after a year of so many sacrifices already. But there are some signs that what we're doing together to respond to these awful circumstances is starting to work. So don't let up. Let's all of us keep doing our bit. And one day, over this virus, we will prevail.
Thank you, Mr. Speaker. I thank the Secretary of State for advance sight of his statement. The Imperial study today is indeed encouraging, but as the CMO said yesterday, we have a long winter ahead. Now, we know that sustained contact, especially in crowded, poorly ventilated spaces, is a driver of infection, and pubs and bars are an obvious risk. So I heard what he said about the 10 p.m. rule, but my concerns relate to everybody leaving the pub at the same time. So what action will he take so we don't see a repeat this weekend of people piling out into city centres, packing out public transport, sometimes all piling in to a supermarket to buy more drink? Now, we on this side completely understand the need for local restrictions, including in Merseyside, as he has just announced. I think it was probably too late for colleagues from Merseyside to get onto the call list this morning, but I think if they were here, they would be keen to press the Secretary of State further on the financial support for Merseyside. This is a region which is hugely reliant on hospitality and leisure, and we know that these restrictions extract a heavy social and economic toll, and so areas need financial support. Otherwise, existing inequalities, which themselves, of course, have a health impact and allow the virus to thrive, will be exacerbated. People need clarity as well. Areas like Leicester, Greater Manchester, West Yorkshire, Bradford have had restrictions imposed on them for months now. Millions of people in these local lockdown areas, like across the North and Midlands, just need some reassurance that an end is in sight. Many want to know when they'll be able to visit their loved ones. Many want to know whether they'll be able to visit their family over the coming school half-term, for example. Can he just confirm, has he now ruled out the so-called circuit break taking place across the October half-term, as was mooted in the newspapers last week? Also, some of the heaviest increases in infection appear to be taking place in areas where restrictions are in place. So why are the interventions not working? Why are the moles not getting whacked? Yesterday, the Prime Minister suggested that the success of Luton in leaving restrictions was because of people pulling together. But I've got no doubt that people are pulling together across Bolton, Bury, Rosendale, etc. So what additional help will they receive to drive this virus down? Now, I believe ministers lost precious ground in fighting the virus by not having an effective test, trace and isolate regime in place by the end of the summer. Testing and tracing is key to controlling the virus. Increasing evidence now shows that the importance of backward contact tracing in controlling outbreaks. So could he tell us, is backward contact tracing routinely happening in areas of restriction, and will he publish data on backward contacts reached? Now, we support the calls from the Health Select Committee today for routine testing of all NHS staff. Will he finally set a date for introducing it? But problems do remain with testing generally. I've just heard of a case in the Rhondda where people have turned up at a testing centre, have booked appointments, but Serco has pulled the testing centre out. And Serco are saying in that area they need the Secretary of State to intervene if that testing centre is to be reopened. Will he do that? Now, on the 8th of September, he told the Select Committee that the problems with testing would be resolved in the coming weeks. That was more than 3 weeks ago. Yet a test still takes 30 to 31 hours to turn around for in-person tests, 75 hours for home test kits, 88 hours, more than 3.5 days, for test results in the satellite test centres, which are predominantly used by care homes. So he hasn't resolved the problems. When will we? And today, we've learned that Deloitte, who are contracted by the government to help run Test and Trace, are now trying to sell contact tracing services to local councils. So the government's own contractor, one of the very firms responsible for the failing system in the first place, now sees a business opportunity in selling information and services to local authorities. They should be getting this anyway, and this is in the middle of the biggest public health crisis for 100 years. Isn't this an utter scandal? How can it be allowed? Doesn't it once again show that directors of public health should be in charge of contact tracing? And finally, Mr. Speaker, this week GPs warned of significant problems with flu vaccine supplies. Boots and Lloyd's Pharmacy have stopped offering flu jab appointments due to issues with supplies. Can he confirm that we have enough flu vaccines available for all who will need one this winter?
Thank you very much. Well, I welcome his support for the measures that we've had to take, and the £7 million of extra financial support for the councils who are affected, not just Merseyside and Holton and Warrington, but also in Hartlepool and Middlesbrough. That's on the same basis as the support for the North East 7 councils that was announced at the end of last week. It is true that some parts of the country have come through a local lockdown. In fact, we've lifted many of the measures, for instance, that were in place in Leicester. We weren't able to lift all of the measures, and the case rate there did then go back up again, although it has now appeared to have stabilised. And Luton is another example where there was a very significant local outbreak, which was brought under control. He asked about increased testing. There is, of course, increased testing going into to Merseyside, and we can do that because we have a record capacity, which has increased yet again this week. He asked about backward contact tracing. Absolutely, we have backward contact tracing in these areas. One of the reasons that we know, sadly, that the highest area of likelihood of picking up a case of coronavirus outside your own household is in social settings is because of backward contact tracing. So there's further information that Public Health England will be publishing today on further work on backward contact tracing to understand how this virus spreads. He asked about the speed of test results. I'm glad to say that the speed of the turnaround of test results in care homes is speeding up. He asked about Deloitte and their contact tracing capabilities. Deloitte have done an incredible job in helping us to put together the contact tracing and the backward contact tracing that we have. And of course they should offer their services to local councils too. On the one hand, he says local councils should have more impetus and more involvement in the contact tracing. And then when a company with great experience in contact tracing comes forward to offer their services, he criticises them. I mean, they can't have it both ways. And of course, these services cost money and they have to be delivered. And I pay tribute to Deloitte, who are doing such a brilliant job. Finally, he asks about flu jabs. And it is absolutely true, as he says, that there is a record rollout of flu jabs. There are enough flu jabs for everybody who needs them in the priority group. I would stress that this is a rollout. Nobody needs to have a flu jab before the start of December. You can have it in September or October. It will then cover you for the winter. And so we are rolling it out, and more appointments will become available in good time. We've got 30 million jabs in total. That is more than we've ever had before. It's almost double what we've typically had in the past, and those are available. I'm really glad to say, Mr. Speaker, that record numbers of people are coming forward to get flu jabs, and I welcome that. But people, as the Royal College of GPs have said, people will have to have patience. They will, if you're in the group, the target group, the over 65s and those with clinical conditions, there are flu jabs available, and it will take us the coming weeks in order to make sure that the people who need those flu jabs can get those flu jabs.
Bradford's been in a local lockdown for weeks and weeks, and the number of cases are going up, not down. But is the Secretary of State aware, Mr. Speaker, of the damage the arbitrary 10 p.m. curfew is doing to pubs, restaurants, bowling alleys and casinos? Is he aware of the jobs that are being lost, all just to see people congregating on the streets instead and shop staff getting more abuse? When will the Secretary of State start acting like a Conservative with a belief in individual responsibility and abandon this arbitrary, nanny state, socialist approach which is serving no purpose at all apart from to further collapse the economy and erode our freedoms?
Thank you very much, Mr. Speaker. I'm going to pay tribute to my honourable friend. And the reason is this. There are some people who rail against some of the measures that we have to put in place. And of course, I understand the impact that they have. And there's reasons for each one of them. But collectively, they're vital for the strategy that we're pursuing of suppressing the virus, protecting the economy and education and the NHS until a vaccine arrives. My honourable friend doesn't agree with that strategy. And I think that's a perfectly honourable position. It's just something I profoundly disagree with him on. And he, indeed, last night was one of the handful of colleagues who voted against the renewal of the Coronavirus Act. So it's perfectly reasonable to make the argument that we should just let the virus rip. I just think that the hundreds of thousands of deaths that would follow is not a price that anyone should pay. I believe in individual responsibility and that in promotion of freedom, subject to not harming others. And one of the pernicious things about this virus is that people can harm others and sometimes inadvertently can harm them in such a way by giving them a disease that leads to their death without even knowing about it, because this virus passes from one to another asymptomatically. So while I, especially myself coming from a small business background, I understand the impact of these things. I get it. But unfortunately, we do have to take action to suppress the virus because the alternative of letting it rip is not a policy that I would ever want to pursue.
Let's head up to Scotland with SNP spokesperson Martin Day.
Thank you, Mr. Speaker. It's vitally important that we find a balance between taking action to suppress the virus and protecting people's jobs and their livelihoods. How confident is the Minister that the existing rules within pubs and restaurants on hygiene, face coverings, table service, maximum numbers within groups and the distances between them are being complied with? And what happens next if they're not? Does the Minister agree with me that avoiding mixed messaging is particularly important? So what message does it send that Parliament's bars are exempt from the curfew? And will he commit to continued cooperation with the devolved governments under the four-nation plan?
Mr. Speaker, I haven't been to the bar recently, but I do not think that the Parliament's bars are exempt from these measures, and I think it's wrong to say so. And I'd be very grateful if you could confirm that, Mr. Speaker, because it is a matter for the House, not for the government. What I'd say is to the honourable gentleman is that other than that point, he makes a perfectly valid point. Of course we keep these measures under review. We want to have the least damaging economic impact consistent with bringing the virus, keeping the virus under control and suppressing it. That's the same strategy that's carried out across all four governments, the three devolved governments and the UK government. It is the same strategy. So yes, we keep these things under review, but we do think that they are necessary in order to keep people safe.
I will confirm, because I think it's, if the honourable member had been in the House, he would have realised, or if he'd spoken to his colleagues, the decision was taken last week. Unfortunately, the newspapers were mischief-making. Those bars were not open after 10 o'clock. Let's get that clear. And I think we ought not to believe sometimes what newspapers say. Right, let's move on to Brendan Clark-Smith.
Mr. Speaker, the government's already made more than 190 billion in support available to protect both lives and livelihoods. And last week I spoke to Tom and Lindsay, the landlords of the Columbia Inn in Ordsall, to discuss the impact that these lockdown measures are having on the hospitality industry, which I know my right honourable friend understands. So can he confirm that ministers will continue to work closely with the sector to look at what further support can be provided for them?
Absolutely, and I think if I spot it correctly, the honourable member's wearing the Parliamentary Beer Association tie. So he obviously knows that of which he speaks. But he's right. He's made a very important and very serious point, which is that, of course, we'll keep working with the hospitality industry, and we'll do everything we can to support them through these times. It is so difficult because of the way that the virus spreads. Therefore, these measures are necessary. We haven't gone for a full-blown lockdown in March. That's because we know far more about the virus because of the test and trace system and because of the massive amount of testing that we're doing and the contact tracing. That does mean we could be more targeted. And my heart goes out to everybody in the hospitality industry who's doing so much.
Daisy Cooper with 2 minutes, as it was the UQ that I've converted.
Thank you, Mr. Speaker. As the House will know, the original urgent question was about the 10 p.m. pubs curfew, and it is clear that after this statement, the government is simply not listening. It seems to be covering its eyes and ears and singing la, 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 la. You say that this is under review, but where is the evidence? The evidence is clear. The 10 p.m. pubs curfew has been a hammer blow to hospitality, and turfing crowds of people out of COVID-secure venues onto the streets is putting lives and livelihoods at risk. Since reopening in July, Mr. Speaker, businesses on every single one of our high streets have put blood, sweat and tears into making their venues COVID secure, but they are trading at a reduced capacity. And now with this pubs curfew, some of them have seen a reduction by a further 50%. The Prime Minister announced this blanket 10 p.m. closing time just last Tuesday. Within hours, the industry warned that it would lead to chaos on the streets, and it did. The shocking truth is that this government has, by its own admission, made no assessment of the cost of this measure to the industry. And Sage has confirmed that it was never even consulted on whether a 10 p.m. curfew would be effective. Now experts are telling us that it's making the risk of COVID transmission worse. Public Health England's weekly surveillance reports are clear. Outbreaks of the virus in hospitality venues are responsible for less than 3% of all cases, and they have not contributed to any of the increase. And yet this government is making thousands and upon thousands of hospitality jobs unviable, undermining public health and killing our high streets. The government likes to talk about balance and tough choices that it has to make between public health and the economy. But the shocking truth is that the pubs curfew is bad for both, and the longer the government defends it, the more damage it will do. Mr. Speaker, people are scared. Care homes are becoming prison-like, students are being locked up, and businesses are saying that without a further package of support, they will be closed by Christmas. I asked for some evidence behind this measure. He has provided none, and that is why this curfew must be scrapped today.
Secretary of State.
Thank you very much, Mr. Speaker. I just want to correct the Honourable Lady on the point that she made about outbreaks. The measures of which the updated statistics will be published today by Public Health England, the measures that have led us to understanding the virus spreads most outside of households when other households meet together, including in hospitality venues, comes from the very backward contact tracing that the honourable member on the front bench for the opposition asked about. The outbreaks data is about where there is an outbreak with significant numbers within one institution, not where individuals go to. So, for instance, within a care home or within a school, where that is then raised as an issue with Public Health England. So I'm afraid she's using a different set of statistics which do not make the case that she puts forward. Where, of course, we all understand the concern is the impact of this virus on so many parts of our economy, and our task is to try to limit the impact on lives as well as on livelihoods, and that's at the root of our strategy.
Albersta.
Thank you, Mr. Speaker. My city has been following the rules. Thanks to the people of Peterborough and excellent council leadership, we have come off the watch list last week. Now, I know data can change, and I also know that my right honourable friend appreciates the issues around the 10 p.m. curfew. But will he keep this policy under review so that those who are doing the right thing, like the people of Peterborough, can get back to something like normality?
Absolutely, Mr. Speaker. And my honourable friend is